first thing I would start with is checking my patient's chart and any physical limitations that they may have. And then I would perform my hand hygiene and make sure I put on my gloves and any other PPE if indicated. Then I would enter my patient's room. Hi, Mr. James. I'm Caitlin. I'm going to be your nurse today. I'm just going to check your ID. Make sure we have the same name and date of birth here. Great. And I'm going to be assisting you with a bed bath today and any other personal hygiene things that you want me to address. And then I would make sure all my stuff is assembled, which it is. And I'd make sure my patient's door and curtain is closed for his privacy. Next, I'd lower the side rail and I would check and make sure he doesn't have any leg compressions or socks on and take those off if necessary. And then I would ask my patient if he needed to use a bedpan or a urinal and assist him in that and discard any of that, change my gloves and perform my hand hygiene again. And then I'm going to raise my patient's side rail, just kidding. I am going to take off my patient's blanket and get him a new blanket. So Mr. James, I'm going to give you a new blanket and then I'll just have you hold on to the old one the new one while I get the old one off of you. And I want to make sure I don't touch it on myself or the floor. And then I would take off my patient's gown, and if he didn't have the snaps, I would make sure to take it off the arm first that doesn't have the IV, and then lower the IV and take the clothes through the IV, and then make sure I rehung the IV and made sure it was dripping at the correct rate. Sorry, low battery. And then next I would put my patient's bed rail back up and fill up my bath water, and you want to make sure it's not too hot, not too cold, and put the soap in it. Then I would lower my patient's bed rail back down and I would have him move closer to me. And I would start in the corner of his eye and move outwards. And then flip my rag and do the other eye and go out from the corner out. Then I can rinse this. And Mr. James, I'm going to wash your face, your ears, and your neck. Mr. James, I'm going to provide you with a bath towel to keep you dry while I start your arms. Now I'm going to start with your furthest arm away from me. Put the towel under you. We're going to wash your hands, your arms, your axillary area. And I'd make sure to dry my patient and then offer my patient any lotion if he'd want any lotion. And then put that arm back under there. And we are going to do this arm closest to me. The hands, arms, axillary. Dry you off here. Provide any lotion if you'd want any. Okay, Mr. James, I'm going to pull down your bath towel, your bath blanket, to about your belly button. And I'm going to wash your chest. temperature in here feel okay? Okay, great. I'm gonna dry that off. Give him some lotion. Now, Mr. James, I'm gonna pull your blanket down just a little bit farther and put your blanket up on your chest for you. Get the umbilical area. You wanna make sure you're cleaning the umbilical area very well, looking for any skin integrity or redness, getting under any folds. Dry you off. Put on your lotion. Are you doing okay? Okay, great. Next, I'm going to move to your legs. Have you bring out your leg, your short little leg here, under the towel. And we're going to wash the toes and make sure to get in between the toes really well. Get under, go all the way to the groin area and dry. Apply your lotion. Okay. Move to your other leg. Let's go ahead and bring your leg out. Wash your leg up to the groin area. On any lotion. Make sure I'm drying. And then at this point I would put up my bed rail and I would want to make sure to change my water at this point probably in my washcloth. And then Mr. James, I'm going to have you roll over to your side. And I will keep you covered as best I can so just your back side is exposed. At this point, I'd wash the back and make sure I'm really checking the gluteal area and making sure there's no redness or skin breakdown. And offer a back massage at this point if your patient would like one. I'm going to dry you off here. Provide some lotion and some skin ointment. And then roll you back over. I'm going to put up your side rail real quick, and you're going to discard of your dirty towels, washcloth, and water, and get clean water and a clean washcloth, and we're going to do the perineal area. So Mr. James, I can assist you with this, or I can let you wash your perineal area by yourself, whatever you're comfortable with. So I take my clean water. Make sure I'm washing per the faculty orders. Okay. And at this point, I'm going to remove my gloves and perform some hand washing. And then I'm going to put some new gloves on. And I'm going to make sure my patient is comfortable, and I put the bed at the lowest setting. Make sure he has new linens, new gown, and make sure his bedside rail is up. And then I'm going to discard any dirty linens, make sure I wash this out, and put away and clean up my mess and make sure my patient is comfortable as possible. And then when I'm done, I'm going to make sure I discard my gloves and perform my hand washing one last time.